Hey everybody, I'm Dr. Willardsen. So today we're going to work on our patient here so in this case you'll notice this mesh here. So this is a titanium mesh. We do this when the patients have no bone. So he had implants in the past, and I have his surgery, I believe it's on YouTube, where we removed, I believe there were about 11 implants. I'll be removing this implant today. And so, and as a result, it left a large defect in the bone. And so we had to regenerate all the bone here in the front of the premaxilla, the anterior maxilla, the front of the upper jaw. And so, and you can see the titanium mesh here mixed with autogenous bone and bone morphogenetic protein, which is BMP, and the tie mesh. The tie mesh acts as a matrix or like a screen to separate the soft tissue, the gum tissue, from the hard tissue to allow the hard tissue to grow. And so we can go ahead and start to place the implants. I'm going to be removing this implant that's already there, and you can see it's barely hanging on. This implant is just kind of hanging on by a thread here. There's not a lot of bone supporting it. So we're going to place this implant here. And now that I also did a sinus augmentation, so you can see the bone has consolidated, and I've got plenty of bone for a nice wide diameter 5 millimeter by 13 millimeter Novo Biocare Tie Ultra implant. So that's just one area. We're going to be placing 8 implants in the upper jaw. So here we go with the next implant underneath the titanium mesh, and same thing. This will probably do 5 by 11.5, possibly a 13. I'll make the decision once I'm in the mouth. And then moving along here, we will continue placing, and you can see the outline of bone that the patient has. And so here we'll be placing probably a 4.3 by 11.5 and give plenty of stability for the final prosthesis that the patient will have, which will be zirconia. And again, all of this, there was no bone here prior to me doing this graft. So you can see how great the, and here I'm going to place a 4.3 by 11.5 again. You can see how great this graft is. I've got all this, there was nothing here, there was zero, the bone was about to this level. So I've grown a good 12, 13 millimeters of bone in this area. So, and as we move along here, same thing. There was no bone in this area, so we're going to place a 4.3 by 11.5 in this spot as well. And having the CAT scan allows me to see exactly what I'm dealing with. I'm able to do the surgery before actually getting in and doing the surgery. So here mainly generated width. Didn't get a lot of height, but I have plenty of height. But the width is what I really like to see here. And so I'm able to place a 5 by 11.5 here with the small nasal lift, floor lift. It's not a sinus lift, it's very different. And so as we move along here, we will be placing a 4.3 by 11.5 here as well. And actually this one will probably move, because yeah, there we go. That's good there. So, and then back here in the sinus, we have a good, nice, densely formed subantral augmentation, sinus augmentation. And so we're able to place a 5 by 13. So anyway, so this is our plan. We're going to go ahead and remove the tie mesh. That'll be the first step. And then once the tie mesh is out of place or removed, I'll take this implant out, and then we'll go ahead and place these 8 implants. So wonderful case, because it really demonstrates a lot. He again, like a lot of the patients I show on my channel or on Instagram or on YouTube, he tried getting implants done somewhere else. They put really short implants in, and there was no real plan as to the final outcome. And so as a result, he lost all of that work, which was equated to almost $65,000. And now we're having to go back in and redo everything, which is the unfortunate part. But the beauty of it is that it can be done. I can restore his case. I can get implants back in, and he'll be good to go, and he'll get what he wanted the first time he tried this. So, but now that I have a substantial amount of bone, I can put a substantial implant in there, which will give substantial support, along with the biomechanics and how I design the case to make sure that everything fits together, articulates together, so that in the end we'll have a successful outcome, and that's what we want from all of our patients here at Trust Implants. Thank you.